Hello everyone. This is just a quick question on, this is in the mental health category or content, nursing content. This is on therapeutic communication. This question says, the nurse is interviewing a newly admitted psychiatric client. Which nursing statement is an example of offering a general lead? So there are different types of therapeutic communications. There are therapeutic communications and non-therapeutic communications, and I'll go over the differences. Okay, so which statement is an example of a good general lead that the nurse is offering to the client when they're interviewing someone who is newly admitted? Okay, so number 1 says, do you know why you are here? Number 2 says, are you feeling depressed or anxious? Number 3 says, yes, I see, go on. Number 4, can you chronologically order the events that led to your admission? Okay, so a general lead is an open-ended response, and it's not a yes or no question. It's open-ended. It's going to give the nurse, or giving the client the opportunity to continue sharing in their thoughts, and the nurse is not interrupting. And you can pause this if you want to try to figure out what the answer is. Okay, so let's go over the answer choices. Number 1, do you know why you're here? So that can be a yes or no answer, right? And so if the client answers no, the conversation is over, and it doesn't offer an open-ended opportunity for the client to share. Number 2, are you feeling depressed or anxious? The client may respond, I'm feeling anxious. So that kind of cuts off the conversation too. Number 3, yes, I see, go on. So yes, I see, go on, is the correct answer. And it is the correct answer because it is an open-ended response by the nurse. Yes, I see, go on. It encourages the client to continue sharing what is going on with them. And then number 4 is, can you chronologically order the events that led to your admission? That's too complicated of a question. This client is just walking in the door. They're newly admitted. They're having to answer all these questions. At some point you're going to get to that, but a general lead is leading the client to open up a conversation with them and share the information on why they were admitted. Okay, and so we're gonna go on to another one. Okay, so these are just short videos on test questions that you can practice with. I'll see you on the next one. This is Dr. Hart, Nursing with Hart, PhD is my YouTube channel. If you enjoy this, then if you would like and subscribe, I would appreciate it. It will put my content out there more for other nursing students and people to gain information from. All right, great, and have a great day.